Hello, I am Kodili-nye is the son of the wonderful. Welcome back to another video. We'll be talking about issue with the health and a new way to change the health system in Onitsha and in Anambra State and in Anibo and Nigeria in general. And we're going to be talking about based on what people have been saying and based on the effort of the Anambra State government, which people commented and talked about. But before we do the justice to this, I do believe that you will like this, and also you will offer your own opinion to this, and also remember to share this and also subscribe, because it's very, very vital that you subscribe to this channel. And I'm going to show you a little clip of by the channel news about when about Onitsha General Hospital last year that was handed over to the federal government to be a federal medical center. And that short clip, after that, we now dabbling into what we are discussing about. Remember, this channel is entertaining, informative, innovative, educative, and generally something that will channel that also push for change. Thank you, and stay tuned as we look at this video from channels news. Remember, this is a reaction and also a discussion series. Stay tuned.
The Onitsha General Hospital is a public hospital established on May 3rd, 1962, and it operates on 24-hour basis, attending to the health needs of the people. Some of its services include surgical, pediatrics, obstetrics, gynecology, dental, mortuary services, among others. However, the legislative power of the senator representing Anambra North Senatorial Zone and the constant memos from the state governor, Prof. Chukwuma Soludo, to the federal government brought about the consent of President Muhammadu Buhari to upgrade the hospital to a federal medical center.
The move to establish this FMC was informed by the need to bridge the existing gap between primary, secondary healthcare and tertiary healthcare delivery in Anambra State and Nigeria as a whole. Diseases have continued to ravage many communities due to the distance between the communities and tertiary healthcare institutions. This new center will ensure provision of excellent physical, mental, and emotional care for all clients. It will create a work environment that values commitment, innovation, hard work, collaboration, and learning. It will balance expected commitment to the poor and vulnerable groups with highly specialized bespoke and boutique services to other members of the community.
Governor Soludo, who is represented by the State Commissioner for Health, expresses gratitude to the President and urges staff of the upgraded facility to also improve their services to meet the expectations of the people.
Please, as we are changing in the final process of making this place a final medical center, I'm pleading with us, the civil servants, that are going to be attending to people, to improve the way we render our service to people. Are we going to do that? We are promising the minister that we're going to improve on that.
The Minister of State for Health highlights the benefits of the upgrade.
To the staff is an increase in salary. But beyond the salary, because they will not be receiving federal scale salary, beyond the salary, they will benefit from increased funding. They will benefit from more sophisticated medical equipment.
The high point of the event is the unveiling and commissioning of the upgraded hospital as the staff burst in excitement.
Welcome back. I am still Kodili-nye. Let us dabble in what we are discussing. Yeah, wealth. This health. They say this wealth, And no society can exist without a proper Medicare and health facilities. So also our homeland, Anambra State and Igbo, Nigeria, cannot perform creditably well if the health facilities are not in top shape and if it's not in quantity and in quality. In the situation whereby we lack the quantity and we lack the quality is a big challenge. So in Anambra State, the Soludo government of Anambra State is trying to reform the health system. But there was a discussion that going on with some people, and they talked about that we can also improve our economy by the way we invest in health system. And that's what we are beginning to talk, and that's what we are going to share now. And what are we talking? They use an Onitsha as an example because Onitsha is like the commercial capital of Eastern Nigeria, a major hub. So they said Onitsha, as we saw the General Hospital Onitsha that was given to the federal government, that Onitsha can completely change, not just by government of Soludo building one or two hospitals in the Onitsha greater region, like the one he's building in almost completed in Okpoko and the one in Fege. But what basically they are looking at something of a revolution, health, which will involve partnership. That partnership, as the governor normally said, will be something that will be done in a way that everybody knows this is where the government is heading to. In health system, let's just look at the major areas in Onitsha Metro. You have Ogidi, you have Mpo, you have Moba, phase 1, phase 2, and all those things. You have Inland Town, you have Fege, you have 33 Nkwele area, you have Obosi, Ugwagba, Wada, you have Okpoko, you have Odekbe. So these areas, so they are talking about as the landlords and tenants them to build infrastructure, that the government can actually make it a way that like a WADA, that the government will say, okay, any layout or estate that have more than 100 buildings or 200 buildings or 10 rows in it should endeavor to have a hospital that will have between 200 to 250 beds hospital. That this will be a competition that they are looking to for every area to start. The government will also encourage it by donating this and this. So now, as soon as the government say this thing as a policy what you will see is a revolution, because every area will try to build a hospital that will be managed either jointly with the government or government will manage it. And what will happen is that you will see a partnership in health. You see in Awada, where you now have Awada community having a huge 4-story high or 3-story high hospital that will have 200 or 250 beds minimum. And you have Ugwagba, they will now have hospital also. And they will also make it that all these markets that have more than 1,000 local shops or 2,000 local shops should have a hospital that have at least 100 beds. 100 beds. So now you see all this market, Ugwaba, old motor spare parts will have a hospital. Main market will have hospital that will have like 250 beds. So now you can see that the whole of Onitsha will be saturated with so much hospitals. Now what the government will do is to help them to acquire some of the facilities that will be in this hospital, and also to deploy medical people. And this hospital, the funding of this hospital will be by the fee people make in this hospital in getting the treatment, which will be to all the members of that layout will be a flat rate. Anybody that is not living in that layout will have to pay so amount of money. So it will be a standard payment. So this will actually, starting with Onitsha, we make hospital not just affordable, but you have a lot of choices of hospitals. You have quantity and you start to have quality. So you start having hospitals that have 200 to 250 beds scattered all over the place. So Onitsha will be having between 10 to 15 new hospitals within 1 year. I mean the hospitals that are regulated by government but done in partnership with the government. Because government has to license it. Government has to provide medical personnel into that place. So think about that. This is what we are looking at. Deepening development objective in our homeland. Thinking deeper. How to, because the governor or the government of Anambra State cannot continuously saying that the most of the wealth and the hands of the people without finding a way of pushing the people, focusing the people on really the area to invest all this money and also enhance the productivity of the state. Think about that. A lot of people will be employed as nurses, midwife, pharmacists, doctors, drivers, security people. So there will be plenty of jobs. And many people will be coming outside the state because of so much hospitals in the state. They will now beginning to bring in more of their money into the state. This is what we are looking for. It doesn't mean that the government should always finance everything. Because if Soludo is talking about that the people have most of this money, what is stopping them from formulating something like this with something to encourage the people? Our people are ready to do this if the government is willing to lead in the front. You can't say to them, oh, just come up with anything. In this channel, if the governor or the health commissioner will listen to this idea, we'll be able to explain to him how that is so easy and possible. And this can be created in other areas. This is health we are talking about. This is part one of this. This is what our channel is. So I want you to come to the comment section to put in your own idea. You can see what we are offering here. We are not just here to talk, and we are really deep in making our homeland the best. Not the second, not the third, but the best. And how can we do that? This is the way we can, one of the ways. And this is the way also to improve our internally generated revenue and create jobs, absorb a lot of people from unemployment market, and also to reduce the security issues in the states and in our homeland. So what is your thought about this? What is your own opinion? Please drop your own comments. Your comments are valid. I do respect your comments and I do read them. I make sure I go through them. And thank you very much for joining this channel. Thank you for supporting us. And I do believe that you will be pleased hearing this. And let God be with you. Remember to subscribe. I am still Kodili-nye, the son of the wonderful. Have a wonderful time wherever you are. Bye. See you in the next one. Bye.